Hello and welcome. My name is Danjuma Ada. I'm a public health expert and the past president of World Hepatitis Alliance. Today we're going to talk about hepatitis B and sexual transmission. So in Africa, the question is sexual transmission a major route of hepatitis B infection? The answer is no. But I have someone, a professor of hepatology, Professor Wendy Spearman, from South Africa, who is going to take you through the science of hepatitis B and sexual transmission. Please listen attentively and learn.
Good morning, good afternoon, and good evening to everyone. I'm Wendy Spearman, a practicing hepatologist at the University of Cape Town, and today I'm going to talk to you about the risk of hepatitis B sexual transmission. I think it's important to remember that in Africa, hepatitis B sexual transmission is not the usual route of transmission. This is usually as a result of mother-to-child transmission during delivery or early childhood acquisition under the age of 5 years. But sexual transmission in adults does occur. And what are the risk factors? Firstly, it relates to how infectious you are, and this relates to how much virus is in the blood. So those with a high hepatitis B viral load have an increased risk of sexual transmission of hepatitis B. And this is particularly relevant in individuals who are HIV and hepatitis B positive and who are not on antiretroviral therapy, as these individuals often have high levels of hepatitis B and HIV in their blood and can transmit both viruses sexually. The type of sexual activity plays a role. Anal sex has a higher risk of transmission than vaginal intercourse, but any sexual activity that results in abrasions and trauma with bleeding increases the risk of hepatitis B transmission. It's also important the timing of sexual activity. During menstruation, where there's bleeding, this increases the risk of transmission, but you should also know what is your partner's status. Are they hepatitis B surface antigen positives themselves? Have they had infection in the past and cleared it? Or are they immune as a result of hepatitis B vaccination? All these factors will determine the risk of your partner acquiring hepatitis B. And so I think we all know that knowledge is power, and we need to actually encourage everyone to know their hepatitis B surface antigen status, encourage them to discuss this with their partner, encourage their partners to be screened, because this is an entirely vaccine preventable and treatable condition. And so we need to break down the fear and stigma around hepatitis B, remembering also that you should always practice safe sex. The use of condoms is encouraged, particularly during the period where your partner is receiving the hepatitis B vaccination with 3 doses. And so I hope I've shown you that hepatitis B is something that you should not fear. It's something that can be treated, but importantly, you can prevent it. You can prevent your partners acquiring it. You can protect your family by encouraging the birth dose vaccine and vaccination of other members within the family. And I think together we need to break down the fear and stigma around hepatitis B. And I hope this has increased your knowledge about hepatitis B, and you'll go forward and encourage everybody to know their status. Thank you very much.